Hi, I'm Dr. Darren Howarth with Summit to Shore Chiropractic, and another video for you today about disc herniations. And so this one's going to be about how to prevent them. So we talked about some treatment, what they are, and this is how to prevent them. So again, this is preventing injury is never 100%. This is always going to work with every single person. Doesn't work. However, there's a lot of things that you can do to be able to help things get better, or to prevent them from happening in this situation. So typically, again, reiterating that disc herniation, is when that disc pushes back into that nerve. It can cut a few different areas, but when that disc pushes back in the nerve, you can get that pain down the leg. So the typical is flexion-based exercises, or anything flexion movement. So if I push here, it makes that disc push back into that nerve. So a couple things, one of which is disc injuries are usually not a one-time scenario where it just happened. It's usually a repetitive trauma that finally, that lifting up the pencil, that picking up the paper clip, finally kind of broke this camel's back, pushes back into that nerve, and now you feel it. But it's going through a lot of layers before it gets there, and typically it's that, like I said, that flexion forward position, and even to make it a little worse is kind of flexion with a little bit of rotation leaning off to the side. So I mean, if I'm in this position and I flex forward, it's that repetitive flexion that's going to cause that disc to move back. If I add in kind of rotation and a flexion side to side with that forward, again, that's going to put a lot of pressure to push it back. So the big issue there is if I go into these positions and then load it, or I'm there for a really long time, there's potential for that to become an issue. So in the sense of like moving boxes, deadlifting, lifting things up, if I'm lifting things and I do it poorly, I'm going to push that disc back and it's going to cause issues. So proper lifting technique is going to be huge with this. So keeping that kind of neutral spine as you bend forward versus kind of rounding like that, and then doing that as much as possible. Obviously, I mean, you think of how many times you bend forward in a day, putting your shoes on, doing the dishes, grabbing something off the floor, putting your pants and socks on, same story. You're always leaning forward. So if you can kind of keep that neutral position as you bend forward, it makes a big difference in trying and decreasing that repetitive nature that typically causes a disc herniation. So that's a big one for you today. If you have any questions, need anything, give us a call, email. We'd love to help you. And thanks for watching. See you next time.